all my fault. Now I'm going to be doing a fundal height assessment on my pregnant patient. So first I would do my regular things of washing my hands, providing privacy, checking my patient's ID band, making sure they understand what we're about to do, ask for permission, all of those things. Then I would make sure that my patient has emptied her bladder, because that can displace the uterus and make this measurement less accurate. Another thing I'm going to want to do is make my patient mostly flat, but I don't want to make her too flat because she's at risk for supine hypertensive syndrome. I believe that's right. So if I do want to make her flat, I need to put a pillow under one of her sides, just a little, or a wedge, so that she's not all the way on her side, so that the baby's not sitting on the aorta. So now I'm going to ask her if I can uncover her belly. Then I'll have a tape measure. I don't have a tape measure at the moment, but that's something that I would have, a paper tape. And I would ask her if I could uncover her belly I can leave her legs covered, and we can cover her chest if she needs to. And then I will ask her if it's okay if I feel her belly, and she says yes. So I'll feel for the symphysis pubis, and then I will take my paper tape and measure from there, and I'm going to feel for the top of her fundus, which is the top of the uterus, and if that's going to be able to correlate about how far along she is in her pregnancy. So if I measure and it's about 25-ish centimeters, then she's about 25 weeks. Usually on many women, the umbilicus is about 20 weeks, so that's typical. So then about 5 centimeters above would be about 25 weeks. So that is how you do a fundal assessment and fundal height assessment. And then also, if I would do Leopold's maneuver, that is when I would do the same, overriding concerns of washing my hands, providing privacy, explaining to my patient. But this would be for where I would place the fetal heart monitor or use the Doppler on the baby. So first, this is to assess the fetal positioning. So I would ask her if I'm able to touch her belly again. I would feel first at the top for the feeling of either a bottom or a head. If I feel for the head, then I'm going to go down the sides. First, I'm going to feel one side for the back, for the flat back, and then I can feel the other side, and then I can feel if I feel the feet or the hands. And then once I feel those things, whatever I'm feeling. So if I feel the bottom, and then the back, and the feet, and the hands, then I would feel the head at the bottom, depending on the gestational age of this baby, and what position they are. So if I'm feeling the head down here, and this baby's in cephalic position, and they're ready to come out soon, possibly. So if I'm feeling the head down here, then I know that if my feet are on this side, my bottom's up here, and the head's down here, then I want to place the Doppler on the right side of mom's belly, because that's going to be where the fetal heart tones are heard best. And then depending on where the back is where I place the Doppler or the monitor. So that's the uterine assessment and Leopold's maneuver.